Hi Venus, this is Dr. Srikanth back again with one more important topic, proteins and their basic structures. Okay, in this video I'll try to cover the basic structural component of the protein, a simple classification, and majority of the questions which are given in various entrance examinations along with the international license exams. And most of us are done with carbohydrates, and we know the carbohydrates are the major things that we take on a daily basis, which get splits into monosaccharides, that is glucose, and this glucose will get absorbed in the body, and that is how we are using our daily calorie intake. Okay, so majority of the daily calorie intake in our body on a daily basis will move around carbohydrates. That is a simple common sense. What percentage according to balanced diet concept, which we'll be discussing in the pedo, a very important concept of pedo. 60 to 70% of total calorie intake of the body is provided by carbohydrates, and leftover 10 to 15% will be provided by proteins, and 10 to 15 to 30% will be provided by lipids or nothing but fats. When these proteins are going to come into existence, we know that the proteins are basically called as building blocks of the body. Okay, they build the body. Like whenever you are planning to go to gym or whenever you start your fitness, so your coaches are going to tell you to take more protein intake rather than the carbohydrate intake, because you're trying to build your muscle, because muscle is the major component of your body, and this muscle is going to require proteins. Okay, so proteins are basically called as building blocks of the body. But normally, what is the maximum component daily intake is basically moving around carbohydrates, that is 60 to 70% of your total diet. Even in the balanced diet concept that we are going to discuss in pedo or in your general medicine, the major servings are going to be your carbohydrates. Okay, I hope you remember that food pyramid and everything. So major component in the food pyramid is basically filled with carbohydrates. So these are the basics that you have to make around. And whenever I'm talking about protein structure, that we are discussing from the school days. Okay, so protein structure is basically combination of amino acids. There will be sequence of amino acids, and these amino acids, sequence of a particular group of amino acids, result in the formation of protein. Protein is basically a combination of amino acids in a simple term, which is shown in this diagram. Okay, what is this protein? This is a protein. Okay, linear structure of a protein, and this protein is basically filled with a sequence of amino acids. Okay, right. So this is the basic thing. And whenever I am looking protein and taking protein structure is divided into different types. Okay, so what are those types? That is the primary structure in a simple term, secondary structure, primary structure. Primary structure is nothing but, you can see the linear structure. The linear structure of arrangement of amino acids is primary structure. Secondary structure is a little bit more complicated. Okay, advanced structure compared to that of primary. And secondary structure, in majority of the situations, it appears in two forms, A and B. Majority, I'm talking about majority. Even there are conditions where you will have triple helical structure also, that is your collagen, because that is the most important protein in the body, which don't fall under this alpha helix, which don't fall under this beta helix. It forms in a different helix called as triple helix. Okay, but majority of the secondary structures are basically divided into alpha helix or beta plated sheet. And which is most common? Your alpha is most common. Which is most common? Alpha is most common. So this is secondary structure diagram. Then comes tertiary structure, a little bit more complicated than the quaternary, which is highly complicated, because here in this quaternary structure, you can see different color coding. 1, 2, 3, 4. Means you are going to have multiple subunits here. You're going to have multiple subunits in the case of your quaternary structure, which I will be discussing in the next couple of minutes. Okay, let's make it as simple as possible. Primary is linear structure. Secondary is going to have two major forms. One is alpha and second one is beta. Now jumping into the primary form, I said like primary form is a linear sequence of amino acids forming the backbone of protein. Okay, so what is this primary structure? The primary structure is basically the linear sequence of arrangement of amino acids. We are very, very clear about this. And other important aspect is the primary structure is mainly responsible for the function of the protein. I'll try to link this concept to degeneration. Whenever you degenerate, means I take a protein, for example, egg is a protein. So I heat the egg, I boil the egg, I heat the egg. egg will get denatured. That is, whatever we are going to eat is a denatured egg. But in the denatured egg, okay, your primary structure will not be spoiled. Primary structure remains intact. Then comes, what are the different types of bonds which are present in maintaining the primary structure? Means arrangement of amino acids. So you see how it looks like. You have your amino acids. Amino acid 1 is going to combine with amino acid 2 is going to combine with amino acid 3. So this is the linear structure which I am talking about. So how these bondings are occurring, the type of bondings that we see in the primary structure, the type of bondings that we see in the primary structures are covalent bonds. We see covalent bonds here. Covalent bonds are very, very important here. So the bond that is present between amino acids in maintaining the primary linear structure is covalent bonds. What are those covalent bonds? One is peptides and second one is disulfide bonds. Disulfide bonds questions are very, very frequently asked for us, which we'll be discussing application based questions on disulfide bonding. Okay, now it's clear. Arrangement of amino acids in the linear sequence is called as primary structure, and it is responsible for its function. Primary structures remains intact even after denaturation. Primary structure is basically maintained by a covalent bonds. Those covalent bonds are called as peptide bonds and disulfide bonds. Clear, done, I'm done. So now I'm moving to the second one, that is called as secondary structure. Okay, so I'm moving to the second one, that is called as secondary structure. And secondary structure is called as, you can remember it as steric or spatial arrangement of protein by twistings of this polypeptide. We have polypeptide. Now the polypeptide is becoming twisted. I have shown you clearly the diagrams of alpha helix and everything. So I'm talking about helix. The helix is basically nothing but twisting. Okay, the twisting. So the configuration of this polypeptide chain is by twistings and foldings. The polypeptide chain is by twistings and foldings. And one very frequently asked question for us, folding of protein is mainly due to which of the following bonds? Their primary structure is mainly due to covalent bonds. Here foldings, because protein has to fold. Okay, the helixes has to fold. The folding is mainly due to, different bonds are there, but foldings are mainly due to hydrogen bondings. Okay, now I told you there are many types of secondary structures, but the most common types of secondary structures are alpha and beta. Out of this alpha and beta, which is most common? Alpha is most common. Done. Okay, now let's look into some basic differences between alpha and beta. Okay, right? So first of all, we'll discuss alpha. So alpha, I told you whatever alpha, whatever beta is there, both of them are mainly maintained by hydrogen bonds. But the type of hydrogen bonding is different in alpha and it is different in beta. What is that? In the case of your alpha, easy to remember, alpha starts with, nothing to get confused, alpha starts with A. Okay, type of hydrogen bonds that I see in alpha helix are intrahydrogen bonds, whereas beta I see inter in between. Okay, in between. Okay, right? So type of hydrogen bonds that I see in alpha helix are intrahydrogen bonds. They move in the same direction. Okay, right? Okay, the next one, alpha helix can be left or right-handed. It can be a left-handed helix, or it can be a right-handed helix. Okay, left-handed helix, easy to remember again, left for less. They are less stable. Right hand is more stable. Whereas left hand is less stable. Okay, I require more stability because protein require more stability, right? So most of the helixes, alpha helixes which are found in the proteins are right-handed. Left-handed are very, very less. Left-handed are less stable. Left-handed are very, very less. Left-handed are less stable. So these are the important points that you have to make a note. So intrahydrogen bonding, which moves in the same direction, it can be left-sided or right-sided. Left-sided is less common. Left-sided is less stable. Right-sided is more common. Right-sided is more stable, and it's most commonly seen in the proteins. And a very, very frequently asked question on amino acids, okay, on amino acids that you have to make a note is proline never found in alpha helix. Okay, prolines are never found in alpha helix. Please write down this. This is a very frequently asked question. Proline amino acid is never found in alpha helix. One alpha helix, if you see the helix, one alpha helix, if you take one alpha helix is going to contain 3.6 amino acids. It's going to contain 3.6 amino acids. Okay, and other important, it is a helix, right? So it is a helix. So helix, it has a net dipole moment. It has a net dipole moment because one direction is considered as positive, second direction is considered as negative. So net dipole moment will be there in the case of your alpha helix. So these are the key points that you have to make out when I'm talking about alpha. What is alpha? Alpha is most common. Alpha is going to have intra-hydrogen bonds, where beta is going to have intra-hydrogen bonds. Beta is going to have intra-hydrogen bonds. Either it will be parallel or either it will be anti-parallel. Okay, now I want to focus on, there I told you beta alpha never exists in proline. Okay, whereas your glycine always exists in beta sheets. Glycine always exists in beta sheets. Okay, right? So these are the important things that you have to make a note about the secondary structure. Secondary structure is mainly causing the twistings and foldings. The twistings and foldings are mainly concerned with hydrogen bondings, and the type of hydrogen bondings are different in two different categories. One is alpha hydrogen bonding, second one is beta hydrogen bonding. I hope this is very, very clear. The concept is very, very clear. Now I'm moving into the third structure. I told you third structure is tertiary. Okay, so third structure is tertiary. Tertiary, again, easy to remember. Tertiary is talking about three-dimensional structure. Tertiary is talking about the three-dimensional structure. So compact three-dimensional structure is there. This compact three-dimensional structure is going to contain hydrophobic chains inside and hydrophilic chains on the surface. On the surface, you are going to have hydrophilic chains, and inside the core, you are going to have hydrophobic chains. And these hydrophilic, hydrophobic things which are going to maintain the stability of the protein, Okay, now if I am talking about the type of bonds that are present in the tertiary structure, okay, the type of bonds present in the tertiary structure, almost all type of bonds. You have hydrophilic, you have hydrophobic, you have hydrogen bonding, you have disulfide bonding, you have ionic interactions, you have hydrophobic interactions. All type of interactions are present. But I'm talking about stability. Stability is being maintained by disulfides bond. The stability is maintained by disulfide bonds. That is the reason why snake venom, okay, is going to be more stable. Why snake venom is more stable? Because snake venom is a protein. It's a protein. It is more stable compared to any other protein. Why it is more stable? The reason is it is going to have more disulfide bonds in it. Stability is inclined to disulfide bonds predominantly. Again, similarly, if you compare keratin, we know that the keratin is also protein, right? Keratin is a protein. Keratin is present in my skin. Keratin is present in my hair. So keratin is present in different locations in the body. Apart from skin, it's present in hair, it is present in nails. Okay, you see, like animals you take. So most of the animals, the protection organs, the horns and everything are made up of keratin. Okay, but you see my nail compared to the nail of a dog, a pet animal, or the nail of a cat, it's going to be more tougher, right? So my skin is having keratin, my hair is having keratin, my nails are having keratin, but my nails are very, very hard. Again, reason. Okay, reason. Skin, the disulfide bonds which are present are very, very less. Whenever your disulfide bonds are very, very less, stability is little less. When it is keratin with less disulfide bonds, the stability will be less. Okay, so that is the reason why those organs, like for example, nails will have more disulfide bonds, more stable, more strengthened. Skin is going to have less disulfide. Even the keratin is present, it is less stable and less strength. Okay, right. So apart from this, a very frequently asked question, keratin is a protein. Protein will always have a group of amino acids. So what are the amino acids which are present in the keratin? Keratinized epithelium, non-keratinized epithelium, para-keratinized epithelium, ortho-keratinized epithelium. Different types of keratinizations we have discussed, right? In perio as well as in your general histology, oral histology too, a very important subject. So we are talking about keratin. Keratin is being deposited. Okay, so what are the amino acids? Keratin is a protein. Keratin is going to have amino acids. So tell me what are the names of amino acids which are present in the keratin. Easy to remember. The code is HAL. HAL. So what is this H? H is histidine, A for arginine, L for lysine. Very frequently asked question in the examinations. Very frequently asked question. Okay, right. Now I'm done. I'm moving to the next part of our structure. So we are done with primary, secondary, tertiary, quaternary. Quaternary is talking mainly about the subunits. Now, till this point, I was talking more about probably about a single polypeptide, how it is maintaining its structure and everything. Now I'm talking about multiple polypeptides. They are basically called as subunits. Not all the proteins. Some of the proteins are composed of 2 or more polypeptides. And whenever a protein is containing 2 or more polypeptides, it is called as oligomer. Those subunits, you have a different polypeptide units, those are called as subunits, and maintaining of all these subunits, the three-dimensional structure or the spatial arrangement of the subunits. I want to be very, very clear. Spatial arrangement of a single protein, spatial arrangement of a single protein is being discussed in the secondary. Protein is discussed in the secondary. Now the spatial arrangement of the subunits is discussed in the quaternary. I hope it's very, very clear. Okay. So now here I want to focus more on, so what are the examples of these quaternary structures? What are the examples of these quaternary structures? The best example I can give for this quaternary structure is immunoglobulin. I hope you guys remember immunoglobulin structure is going to contain 2 heavy chains and 2 light chains. Okay, if you go back to microbiology, check immunoglobulins. First, I'll be talking about the immunoglobulin structure. So immunoglobulin structure is basically tetramer. It is a tetramer. It's going to contain 4 components. What are the 4 components? 2 light chains, 2 heavy chains together form an immunoglobulin. Okay, right. So I'm not talking about the immunoglobulin subunits. Again, immunoglobulin subunits is a different concept. So if I'm talking about immunoglobulin subunits, I just do make a note. It is a link to your microbiology. So if I'm talking about immunoglobulin subunits, there are only 2 immunoglobulins which are going to have multimers in it. Okay, so one immunoglobulin is IgA, that is particularly the secretory IgA, which is present in saliva, will be available for us as a dimer. And second one is IgM is basically a pentamer, means 5 units together you will be having. Okay, so your IgA is going to be a dimer with 2 subunits, whereas IgM is going to have 1, 2, 3, 4, 5. It is available like this. It's a pentamer. Okay. So the 2 subunits of IgA or 5 subunits of IgM are holded together. That is J chain. They require a chain to hold together. So that is chain is called as J chain. So now the question is, J chain is present in which of the following immunoglobulins? Your answer is IgA. That is particularly I'm talking about secretory IgA, which is present in saliva, and IgM. So both of these are going to have multiple subunits. To hold multiple subunits, you require a J chain. Okay, that is one important thing you have to make a note. So again, I'm going back. So what are the protein subunits which are present in any immunoglobulin? Your answer is 2 heavy chains plus 2 light chains. So it is tetra. 4 units are present. Similarly, I'm talking about hemoglobin. Hemoglobin is also going to have a quaternary structure. What we have discussed in physiology, hemoglobin. Hemoglobin is going to contain 2 alpha chains, 2 beta chains. Different types of hemoglobins are there. Fetal hemoglobin is different. Okay, you see embryonic hemoglobins are different, but most of the immunoglobulins in general, like for example, if I'm taking adult is going to contain 2 alpha, 2 beta. So it is also tetramer. It's going to have 4 polypeptide units, subunits. Okay. Similarly, you have creatine kinase. Creatine kinase is very, very important when I'm talking about biochemistry. So creatine kinase is basically available as a dimer, and lactate dehydrogenase is basically available as a tetramer. So all these are important things. So all these are going to have quaternary structure. A very frequently asked question is, which of the following is the best example of a quaternary structure? Which of the following is going to have a quaternary structure of protein? Your answer, best options they are giving is, one is immunoglobulin, second one is hemoglobin. Very frequently discussed terms and terminologies. Okay, I hope you guys are clear with the structural component of the protein. Now I'm going to jump into a few important lines that you have to make a note, questions which are frequently given in all sort of examinations. Okay, one is, I told you, the most abundant protein that is present in the body Most abundant protein that is present in your body. What is the most abundant protein that is present in my body is collagen. Everywhere you see collagen. Even if you see the structure, except enamel, dentin is going to have collagen, cementum is going to have collagen, pulp is going to have collagen, PDL is going to have collagen, alveolar bone is going to have collagen. So everything is filled with lots of collagen types, which we have discussed so many times. So most abundant protein that is present in the body is collagen, and collagen is giving us strength. And of course, we require vitamin C for collagen. Again, vitamins are important things when I'm talking about biochemistry. So next, the most abundant protein that is present in blood. Definitely the answer is albumin. Albumin is the most important protein that is present in the blood. So be very clear what's the question that is being asked for you. Whether they're asking body, your answer should be collagen. Whether they're asking blood, your answer should be albumin followed by globulin. And most of this albumin and globulin are going to maintain the oncotic pressure in the blood. Simple. I don't want to go very deep into this. So when I'm talking about collagen, when I'm talking about the secondary structure of collagen, collagen is not going to have either alpha helix or beta plates. It is going to have a structure called as triple helical structure. A very frequently repeated question. Triple helical structure is seen in which of the following protein? Your answer is collagen. Collagen is linked to which of the following vitamin? Your answer is vitamin C. Okay. I don't want to go very deep into this. Okay. There is some other terms called as reverse turns. Normally, what is happening? Helix. So if you take this helix, it is rotating like this. So sometimes what is going to happen? The helix can take a return rotation. Sometimes it bends reverse bend. Okay, I'm going on a road. Okay, sometimes I take a reverse bend also. Okay, so that is in a simple terms called as reverse turn, also called as beta bends. Normally it is forward. We have discussed it is a forward one. Even if you take beta sheets are either parallel or anti-parallel. There are no bends, reverse bends here. So, but in some cases you can see reverse turns also called as beta bends. What is this basically? It is basically called as reversing the direction of the chain. Chain is going forward, and now what it is turning, it is reversing. Okay, so where these reverse turns are most commonly seen? The reverse turns are most commonly seen on the surface of globular proteins. Reverse turns are most commonly seen on the surface of the globular proteins. We will be discussing the classification of proteins. So in the globular proteins, I am going to see these reverse turns, and reverse turns are most commonly present in which of the following amino acids? Reverse turns are most commonly seen which of the following amino acids? Very frequently asked question. The answer is fluorine and glycine. The answer is fluorine and glycine. So next important term is chaperones. Chaperones are also called as HSP70. HSP70 is nothing but it is called as heat shock protein 70. A very frequently asked question. So one important function of this is they helps in folding. The other important function is they are going to bind to the hydrophobic amino acids, and by which they shield the particular protein from the solvents and agglutation. Okay. Normally, we have discussed a lot, right? Proteins requires the folding. The compact structure of the protein requires folding and everything. If protein does not fold, so what is going to happen? That leads to easy degradation of the protein. Stability will be lost. If there is no stability for us, what is going to happen? We easily dissociate. Okay, so whenever you are preparing for an entrance exam or a competitive exam, particularly or a license exam, anything is like competition. The faster you enter into the competition, the better the survival rates are. Okay, so what happens is here for us or for a protein, stability is most important. Okay, the stability is most important. If you don't have stability, what is going to happen? It's very easy. That leads to degradation and that leads to conditions. So whenever there is an issue with protein folding, that lead to condition called as cystic fibrosis, respiratory disorder. Most of us are aware of this. And similarly, you have Alzheimer's. Okay, so whenever your proteins are leading to degradation, okay, so this degradation can lead to accumulation of few compounds. So this accumulation of few compounds in the body can lead to a CNS issue called as Alzheimer's. Okay, the cystic fibrosis, Alzheimer's are examples of defect in folding of proteins. Okay, so I think those are the important things that I want you to make a note. Now I'm moving to the denaturation of proteins. Okay, so denaturation is nothing but changing the structure, spoiling. Okay, it's a denaturation of proteins is a very important concept that we have to make a note. Okay, and one important thing is what is the reference protein? Very frequently asked question. Reference protein is egg. Egg is considered as reference protein. Okay, now so denaturation is a very important concept. So denaturation is protein is a structured thing, organized thing. Okay, it has a primary structure, secondary structure, tertiary structure, subunits are going to have quaternary structure. So everything is maintained well in protein. So whenever that is being disturbed, so whenever there is a disturbance of the structured structure of the proteins, okay, that leads to denaturation. So there are agents which are going to cause the denaturation of the proteins. That can be a physical agents or that can be a chemical agents. The physical agents can be heat. What I'm doing is I'm taking an egg, breaking it, turning into an omelette or a boiled egg. I'm doing it. What I'm doing, I'm denaturing. So that's a physical method. So by heat, what I'm doing is I'm denaturing the egg. Or sometimes you take a protein, shake it vigorously. Okay, so what is going to happen? That can also lead to denaturation. Or you can use X-rays or UV rays, and most of the methods, there are different types of methods for denaturation of a protein. Similarly, I can use chemicals. I can use either acids or bases or organic solvents or salts of heavy metals. I can use urea, salsates, detergents, and all these things. They helps in the denaturation of a particular protein. So these are the physical and the chemical agents which helps in disturbing the structure. All structures are disturbed. What structure is not being disturbed? My primary structure is not being disturbed. So now I'm talking about in detail about the denaturation. So what happens during the denaturation? I'm disturbing the structure. All the structures are being disturbed except the primary structure. So your helical structure of protein is being lost. Okay, and your primary structure is still intact. The only structure which is still intact is the primary structure. Your biological activity of a protein, the biological activity of the protein is lost. So denatured protein become insoluble in solvents which are originally soluble. So viscosity increases, surface tension decreases. Viscosity and surface tension are inversely proportional. Your dental materials concept. So there is increasing in ions and increasing in the sulfur hydryl group functional groups. Denatured proteins are easily digested. You see your egg, whenever it is denatured, the digestion is going to be easy. Or whenever your vegetables and everything, whenever we are boiling, so what is going to happen? The boiled is denatured one. The denatured one are easily digestible. That is the reason why we try to, most of the proteins what we do, we try to cook them, boil them or semi-cook them, and then we are going to eat, because that will help us in digestion process. Normally whatever denaturation I am going to do is irreversible. If you take an egg, now I converted that into an omelette or a boiled egg, I cannot reverse it back. Okay, but there are few conditions where you can reverse it back. So not for all the proteins. Okay, that is careful denaturation is sometimes considered as reversible. So that reversible process is called as renaturalization. So I'm going to talk about an example. Like for example, whenever there is a poisoning. So whenever there is a poisoning, okay, what type of poisoning? Salsates poisoning. So whenever there is a salsate poisoning, so your hemoglobin which is present will get denatured. So whenever I am giving an antidote to this, whenever I'm treating the salsate poisoning, so what is going to happen? Your hemoglobin will again come into normal condition. So that is a condition where in a selective conditions, in a careful denaturation can occur, in which the denatured protein can be reversed to a normal. Okay, so denatured proteins cannot be crystallized. Okay, so these are the important things that you have to make a note. The most very frequently asked question is which of the following structure in protein is being maintained? What structure is being maintained? Your primary structure is always intact. Okay, means your amino acid sequence in the protein, even if it is denatured, will not change, whereas the other structures are going to change. Okay, so apart from this, again I want to add few important lines, questions which came in the examination. Okay, so tests, coming to tests very frequently asked. Okay, so one is Burette test. Burette test is a test that is useful to identify the proteins. Burette test is useful to identify the proteins. Again, a old question. Ninhydrin test is used to identify the amino acids. So both of them are useful to identify the proteins. Very commonly asked questions. And I want you to add one important line. Okay, I think this is very, very commonly heard protein name in our reading part when you're preparing for dental entrance examinations. Okay, so that is basically protein that precipitates around 40 to 45 degrees centigrade. Okay, at 40 to 45 degrees, you take this protein. This protein is basically taken from urine. So you're going to heat it to 40-45 degrees, it precipitates. And whenever you overheat it, that is to boiling point, at a higher temperature, it dissolves. So it appears at 40 to 45 degrees, you overheat it, it dissolves. So this protein is called as Ben-Jones protein. This protein is called as Ben-Jones protein, a very frequently asked question. Okay, so this is basically monoclonal antibody of a light chain. This is basically a monoclonal antibody of a light chain, and these Ben-Jones proteins are basically associated with which condition? So they are associated with multiple myeloma. They are associated with multiple myeloma and few other cancers also. You see, very frequently asked question for us, multiple myeloma. Okay, now there is one more protein called as cryoglobulins. Cryoglobulins is cryo means very extreme cold temperature. So this protein is going to precipitate at a cold temperature. It's going to get precipitated. At a heat temperature, it's going to get dissolved. So that type of proteins are called as cryoglobulins. Next one is pyroglobulins. Pyroglobulins have a similar concept of the pyroglobulins are going to have a similar concept of your Ben-Jones proteins. So these proteins are going to precipitate when you heat to a temperature around like 45 to 50 or 40 to 45. So these are going to get precipitated and does not dissolve on cooling. So does not dissolve on cooling. Normally cryoprecipitates are going to dissolve on cooling. Okay, so these are going to get precipitated whenever they are heated to a temperature and they does not dissolve on cooling. So such a proteins are called as pyroglobulins. Okay, so I hope you guys are very, very clear. So now I'll be moving into the next few important lines. Okay, so proteins are normally segregated because you have a different methods to segregate the proteins. So one is whenever I'm taking a serum, okay, the serum from the blood I'm going to take, and whenever I am sending it for electrophoresis, okay, so I'm sending it for electrophoresis. That electrophoresis is basically called as paper electrophoresis. So from my serum, I'm going to get the following components. What are the components? I'm going to get albumin. I'm going to get albumin. I'm going to get alpha 1, alpha 2, beta and gamma globulins. Okay, which is predominant among these because this is a question already given in the exam. In paper electrophoresis of a serum of a human being, which is more predominant component? I told you the more predominant component is definitely, already we have discussed, the most important protein in the blood that is present is albumin, followed by all other globulins will be there. Okay, so it is albumin is the answer. Similarly, if I am taking my serum, and if I'm testing the lipoproteins which are present in the body, by electrophoresis, I'm going to get all these things, that is HDL, LDL, VLDL, LDL and chylomicrons. All these things again I'll be discussing, don't worry. So they are going to come under lipids metabolism. The next step after proteins is lipids metabolism. So these, try to remember these concepts. Now I'll be jumping into the basic classification of proteins. So proteins are group of amino acids. Okay. So proteins are basically classified into three categories. One is simple proteins. Second one is conjugated proteins. Third one is derived proteins. What are simple proteins? Structurally, they are proteins. Conjugated means combination. They are combined with other structures. They form a bond with other structures, other components, and they form a protein. For example, nucleoprotein. What is this nucleoprotein? Nucleoprotein is a protein which is bonded with nucleic acid. So that bond is basically called as covalent bond. Conjugated proteins are going to have CC covalent bonds. Okay, glycoprotein, so combined with glycogen. Mucoprotein combined with mucin. Lipoprotein combined with lipid. So proteins are combined with other structures to form conjugated proteins, and the conjugated proteins are going to have a covalent bond. Derived proteins. What are derived proteins? You have a protein and you are breaking that protein. Or you have a conjugated protein. Now you are breaking it, splitting the protein part and non-protein part, and taking that protein part. So that splitted protein part is called as derived. Means I'm deriving this particular protein from some component. That component can be either simple protein or that component can be either conjugated protein. So now I split it. Whatever component, I'm basically getting it as primary component. And I'm splitting that primary component, making it like a multiple splits. Those are called as secondary proteins. I'm trying to make it as simple as possible. So we'll look into the examples so that you'll get a clear-cut idea. Okay. Now simple proteins are basically divided into two types. One is globular proteins. Second one is scleroproteins. Scleroproteins are nothing but called as fibrous proteins. These fibrous proteins are very, very important for the body. So most of the protein that is present in the body is collagen. Collagen is a fibrous protein. It's a fiber, collagen fibers, right? Okay. So most of the protein in the body is fibrous proteins or scleroproteins, which are going to maintain the strength of the body. So that is your collagen fibers, elastic fibers, your keratin, and all these are going to come under the examples of fibrous proteins or scleroproteins. Very frequently asked question for us. So globular proteins are, most of these globular proteins are albumin. I told you, like, the most common protein that is present in the blood is albumin. And the most common protein that is present in the body is collagen. Collagen comes under fibrous protein. Albumin comes under globular protein. Other one is albumin, globulin, histones. All these are going to be the examples of your globular proteins, but most of your examples will move around albumin and globulin are the very common globular proteins coming under the category of simple proteins which are present in the body. Whereas coming to the fibrous or scleroproteins are collagen, elastin, keratin. Here I want you to make one very, very important concept. There is something called as axial ratio. Means you take a protein. For example, this is the structure of a protein. I took a protein. What is this axial ratio? Axial ratio is basically, this component is called as length. The other component is called as width. Length by width ratio. Whenever my length by width ratio is more than 10, that is fibrous proteins, because these axial ratio will tell you the strength of the protein. So fibrous proteins are going to have more strength, so their length by width ratio will be more. Similarly, when the length by width ratio or the axial ratio is less than 10, those types of proteins are called as globular proteins. That is nothing but called as your albumin and globulin. Hope it's very, very clear. There is one more important concept. Whenever I want to separate, what I'm going to do, I'm going to centrifuge. Okay. So whenever I'm going to separate, I'm going to do centrifuge. Okay. So whenever I'm doing centrifuge, what is going to happen? The first proteins to get precipitated are fibrous proteins. Very frequently asked question in the process of centrifuge. The first protein to get precipitated, the first type of protein to get precipitated is fibrous proteins. Predominant proteins in the body, fibrous protein. Predominant protein that is present in the body, collagen. Which type of proteins are going to provide you strength for the body? Fibrous proteins. Now the second one is, I'm jumping into conjugated. Conjugated, C for C. It has a bond, collagen bond. Protein is going to have a bond with other derivative. Okay. Now the derivatives are, the best example is chromoprotein. Chromo means color. Color oriented protein is hemoglobin. Okay. Similarly, mucoprotein. Mucoprotein is mucin. Mucin is a mucoprotein. Again, that's a repeated question. Okay. So metalloproteins are going to have a protein combination with a metal in them. Okay, now jumping into derived proteins. Derived proteins are basically derived from either simple proteins, okay, the simple wala, or the conjugated one. Okay, now I have my derived proteins. Derived proteins are basically divided into primary derived proteins, secondary derived proteins. Okay, primary derived proteins. Primary derived proteins where the breakdown, okay, whenever you're talking about the breakdown is very, very mild. Okay, and there are few bonds which are going to break down, but not all the bonds. So whenever I'm talking about, there is no peptide bond breakdown. Peptide bonds are very, very strong because peptide bonds are the one which are going to maintain the primary structure. There will be mild breakdown, but not complete breakdown. And particularly when I'm talking about the peptide bonds breakdown does not takes place in primary derived proteins, whereas peptide bonds breakdown takes place in secondary derived proteins. Secondary derived proteins, peptide bonds are going to break. Primary derived proteins, peptide bonds are not going to break. So now I'm going to see the examples. You see the end product of proteins. End product of proteins means end product is basically going to come in derived proteins, that too secondary derived proteins. You see all P's. So all P's. Okay. So these are semi breakdown proteins. These are complete breakdown proteins. Complete breakdown proteins are seen in the case of your secondary derived proteins. Partially mild breakdown proteins are seen in the case of primary. The biggest difference between these two is no peptide bond breakdown is seen in the case of your primary proteins, and peptide bond breakdown is seen in the case of your secondary proteins. Okay, so this classification is a very, very important thing. Okay, so these are some basics that you have to note down when I'm talking about the proteins. Okay, so I hope this video is useful for you. Okay, so for more such content, do follow MDS CONQUER channel. Okay, study well, take care, see you.